Statewide monkeypox cases sit at 786 with 11 hospitalizations, while our county remains the same total number of cases as yesterday, 28. I spoke in depth about monkeypox and the vaccine with Riverside County Supervisor Manuel Perez. Supervisor Perez, first off, I'd like to start by asking you about monkeypox here in the Valley. Your reaction to what's been happening, and also, do you think the county is doing enough?
Our concern, what the county has brought to my attention, is that obviously cases are on the rise. Not like COVID, but nonetheless on the rise here in our region, specifically in the Eastern Coachella Valley. Specifically in Eastern Riverside County compared to other parts of the county Riverside, and specifically in the Palm Springs, Cathedral City area. And so public health has been adamant, has been very forward in reaching out to the Department of Public Health at the state level, letting them know about the need for vaccines, the need for support, and that we need that now, right? And so we're going to continuously to push. I'm asking staff to push. And my understanding is that there's constant conversations with Dr. Galley on the issue. Unfortunately, we were limited in size of amount of vaccines, but there's more that we can do by continuously just advocating. I know that the assembly member, I know that the congressmen are also working on this issue, and we need to do everything we can to make sure that we get those vaccines here.
I'm sure you've heard the criticism from some folks, including Evan Garber, who was the first confirmed monkeypox patient in Riverside County. I know he sent you a letter saying that they feel like the public health department has not been responsive or been proactive enough in terms of dealing with monkeypox. Your reaction?
Well, I would just say to them that unfortunately we rely on the state of California and the allocations come from them. We've been requesting more vaccines since the get-go, and there's only so much we can do, but we're going to continue to advocate. We're going to continue to request. We're going to continue to make those phone calls.
So in your opinion, Supervisor Perez, what needs to happen immediately to help with some of these concerns that people are dealing with?
We need to make sure that we get those allocations to us. We need to make sure that we provide those vaccines through our community health centers, whether that be DAP, whether that be Borrego Health, whether that be through our county clinics. We need to make sure that we do the outreach and let people know as soon as we get notice that we have them in hand, and if they feel like they need to be tested, to come on and get tested, and then as well to, if they are testing positive, that they actually get the vaccines.
Is it frustrating, sir, to see how other counties have responded to monkeypox and people can get the vaccines there?
But I would ask which counties, because I understand that most counties are having a struggle with it as well. I understand that in certain counties, potentially they may have more vaccines, but everyone is struggling to receive the vaccines.
Okay. Anything else you would like to say about monkeypox here in our valley?
Just know that we're all advocating for our constituents. The county can always do a better job when no one's perfect. And we're going to continuously do what we can to ensure that ultimately we get the tests and we get the vaccines, and then we do the outreach, and that people feel secure and safe here.
All right. Supervisor Perez, we appreciate your time. Thanks for joining us.
Thank you, Peter. Take care.